Okay. Good afternoon, everybody, and welcome to the Mount Sinai Innovation Awards. This has become an annual tradition, thanks to the extraordinary creativity and talent of everyone on campus, with a number of hosts, and each year the prize list gets bigger, the talent gets greater, and we're very proud of this, and this is really fulfilling a vision of Dean Charney's, in part when he appointed me as Dean for Therapeutic Discovery in 2013. So congratulations to all the winners. Small housekeeping note for the winners. We'd like to take a photograph of all the winners together, so please stick around if you're on site. For those of you in Zoom land, I will figure out a way to incorporate you as best we can. And for those who don't remember, I actually am about 6'1", because you've probably only seen the upper half of my body for the last 3 years. So it's good to see you all in person. Dean Charney has a competing obligation, so he's agreed to say a few words, and we want to get started. Dennis, are you there?
Yes.
Let's just get the camera on you.
Yeah. First, well, Scott, 2013, time flies. Thank you for the great work you're doing.
Thank you.
And, for MSIP, yourself and others who put this program together and, have reviewed all the great research that's going on and selected a wonderful group of winners. And, when I looked at all the winners, they represent, the best of Mount Sinai in terms of innovation and entrepreneurship and pushing the envelope. I know it was hard to make these selections because we got so much great work going on at Mount Sinai. Yeah, as Scott alluded to, I wish I could be there. Essentially, starting in a few minutes is a remembrance and celebration of the life of Barbara Murphy, who was our great chair of medicine until she passed away a little over a year ago. And we're naming our division of nephrology in the Department of Medicine, after her. So I wish I could be there, but I also have to be at remembering, Barbara Murphy, who was such a great citizen, great scientist, of Mount Sinai and around our country and around the world. So again, congratulations to all the winners, and thank you for all the work you do for Mount Sinai, and thank you for all those who were responsible for putting on this event this year and every year.
Thank you, Dean Charney. It's an honor to have you join us, and good luck. I also want to extend my thanks to Eric Liam, Louise Lammers, the entire MSIP team, who've really worked hard to identify the winners, but more importantly for their partnership all year. They do an incredible job. They're probably the most talented and unique group of staff in this role in any academic medical center in the United States. Also, I want to thank Najib Abdullah and Melody Tam and Grace Lee in the Dean's office and my office, who worked furiously behind the scenes to put this all together as a hybrid event. So thank you very much. We have a number of awards to present. When we have presenters who will come up and describe the award, I think one or two of them are on Zoom, and then the awardee will come up and we'll be handing you the lovely prize or plaque at the same time. So without any further delay, I'd like to introduce Eric Liam, who's the Chief Commercial Officer, Senior Vice President of Mount Sinai Innovation Partners. I know you have 3 or 4 other titles, but I'll just summarize it by saying Eric has been one of the most impactful individuals in this campus since he arrived about 6 years ago. And the awards in part and the talent that they have recognized and nurtured is a testament to his leadership and that of his team. So Eric?
Great, thank you so much. The Inventor of the Year Award recognizes excellence in translational research, specifically research that has or will result in the development of a product that will benefit patients worldwide. I'm pleased to announce that we're celebrating the contributions of Dr. Stephen Bierikoff as the 2022 Mount Sinai Inventor of the Year. Dr. Bierikoff is the Dean for Cancer Innovation, the Lillian and Henry M. Stratton Professor of Cancer Medicine, and the Chief of Pediatric Oncology at the Icahn School of Medicine. Dr. Bierikoff's years of research on the biology of HPK1, led to partnerships with Pfizer Corporation and Cullinan Oncology for the development of therapeutics in the field of immuno-oncology. Please join me in congratulating Dr. Birkhoff as the 2022 Inventor of the Year. You want to take the picture first?
Well, thank you, Eric. In fact, I want to thank Eric Liam and the entire MSIP group. I would not be here today if it wasn't for the support that they provided. So I want to give you a few minutes, which is all I have, about HPK1, which is not a household name. The field of immunotherapy, as Eric mentioned, has developed over about the last 15 years, coming out of basic immunology. And it is the effort to use our immune system, especially T cells, to be able to fight cancer. It really is a discipline in terms of its clinical application of, as I said, only 15 years. About 7 or 8 years ago, 2 Nobel Prizes were given for it to Jim Allison and Tasuku Honjo. They developed antibodies that were directed to the T cell that prevented them from being inhibited. So normally T cells get activated and then go back to rest so we don't develop autoimmune disease. The antibodies they developed that target the cell surface are macromolecules. They're antibodies that prevented this induction of a quiescent state. About 15 years ago, in fact, with Saba Azalban, who is in the room was a graduate student of mine, and we began working on HPK1. What we discovered is HPK1 was a serine threonine kinase in the cytoplasm of immune cells. And we and several groups found that HPK1, when activated, was there to bring the T cell back to rest. So what we did is set out to inhibit the inhibitor. In fact, initial experiments were done to be able to show that mice that lacked HPK1 could reject tumors much more readily, and that was part of Saber's graduate thesis. We then went on and actually noticed that a drug already made by Pfizer called Sutent, used as a chemotherapy drug in renal cancer, had an off-target effect on HPK1. That was noted by Sansana Sawastikal when we were working together several years ago. So we actually took that information and went to Pfizer and in fact were accepted into a program that Eric Liam started called the CTI program, which was the Center for Therapeutic Innovation. I remember, in fact, Scott led that committee. We were funded by them. They were that impressed by the initial work that they took it internally, and over the next 5 years developed a drug, which has now gone into clinical trials as of February to treat metastatic cancers, of which there has not been another response. So we will find out over the next 3 years as they put patients on this trial, whether or not HPK, which is a kinase inhibitor, could in fact reverse the effect of cancers and enhance the T cell to respond. Subsequently, we noted using genetic experiments that if you knocked out the entire HPK1 molecule, these mice responded even better than if you inhibited the kinase. And we were fortunate to be at a meeting with John Jin, one of the heads of therapeutic chemistry, who had developed and part of the development of what are called PROTACs, or degraders. And so, in fact, we had the opportunity to degrade HPK1 in mouse and human T cells and see what happened. And in fact, it turned out that we could get an enhanced T cell response. In mice, we could actually see tumor rejection. Went on a roadshow with the help of MSIP, and in fact, were funded as of last January by Cullinan Oncology, we being ourselves, and John Jin's group, to develop an oral HPK1 inhibitor and hope to be able to do that within the next couple of years. So it's really been, having started off as a basic immunology in Boston many years ago, to finally do something that might be important, besides publishing lots of papers. So again, I want to thank Eric. I want to thank Dennis Charney, who also was part of this effort, and certainly at MSIP. They did an amazing job in helping us, in fact, both to find the funding, but also providing insight in terms of how we could move on and develop therapeutics. So thank you very much.
Great. Thanks. The Transaction of the Year Award recognizes Mount Sinai researchers that have created technologies that have been licensed to companies for commercial development where the licensing transaction is substantial and innovative. I'm honored to recognize Linus Biotechnology as the recipient of the 2022 Mount Sinai Transaction of the Year Award. Linus is a well-funded startup company focused on the development of diagnostics and prognostics that are based on past environmental exposures. The company's initial diagnostic, named StrandDx-ASD, received breakthrough designation from the FDA for autism spectrum disorder. This diagnostic was developed at Mount Sinai by Doctors Manish Arora, Christine Austin, and Paul Curtin, who are here today to accept this award. Please join me in congratulating them as we recognize Linus Biotechnology for the 2022 Transaction of the Year Award.
I'll keep this very brief. First and foremost, I just want to say something that Paul and Christine, I couldn't have done it without you. This was a journey. I'm going to share a few personal moments in this journey. I remember trying to raise the Series A. My father in India was diagnosed with COVID, the Delta variant. When I saw him, I knew there wasn't much hope, so I brought him home, to his home in India. And I sat with him for a week, just waiting for him to pass away. All that time, I was still making the Series A pitches, And I can't tell you how hard it was and how many times I just lost hope. But just being able to turn to Paul and Christine is what gave me the strength to keep going. And then we were successful. We raised a significant Series A. We're only 6 months old, and as Eric mentioned, we have FDA breakthrough designation. What Eric doesn't know is just last week we submitted our second application to the FDA, StrandDx-ALS. So please keep your fingers crossed. So far, the questions from the FDA have been quite answerable, so let's be optimistic. The journey in front of us is bright, but it's a big one. I'll just convey the science that we do because it's such a new science by giving you one little analogy. Every test that you have in your life, a blood test, a urine test, even an MRI, is just a snapshot. But can you think of one thing in your body that's static? The answer is no. Everything in our body is moving. This is the first technology anywhere in the world that can measure the dynamics of your physiology, all from a single sample. It has the power to give you information that is equal to 1,000 or 2,000 liquid biopsies, all non-invasively, all from a single sample. Before I conclude, I just want to thank a few people. First of all, Austin Curtin, who's sitting there and will be playing a big role at Linus leading our data science team. I want to thank Eric, Felipe, Chris, William, and their team at MSIP, and a special thanks to Louise Lammers, because I remember having a few conversations with her about 4 or 5 years ago. I had more hair back then. You haven't aged at all. And all of those little conversations, all of that little encouragement meant a lot. The last person I will thank is the late Barbara Murphy. There were times when I was like, this is really hard. You know, maybe I should just be an academic and publish papers like Dr. Burakov said. We can publish a lot of papers and just, maybe that's enough for me. But she really encouraged me, even though she was terminally ill, she continued to encourage me. That's the type of person she was. So Barbara, wherever you are, thank you. And I'll stop there. Thank you to all of you.
The Lifetime Achievement Award for Innovation recognizes an inventor who has made significant impact on society through healthcare innovation and commercialization, and is considered a global key opinion leader and contributor in their field. We're pleased to announce the recipient of the 2022 Mount Sinai Lifetime Achievement Award for Healthcare Innovation, Dr. Robert Desnick. Dr. Desnick is the professor and chair emeritus of the Department of Genetics and Genomic Sciences at the Icahn School of Medicine. His many years of research at Mount Sinai focused on understanding and developing solutions for rare metabolic diseases, and in collaboration with others, led to the development of therapies for Fabry and Niemann-Pick disease and acute hepatic porphyria. As another measure of Dr. Desnick's contribution to research and society, he published 590 peer-reviewed articles so far, 250 book chapters, 10 books, and is an inventor on 26 U.S. patents. He fostered a culture of innovation and serves as a mentor for faculty and fellows in genetics and genomic sciences, and more broadly across the institution. So please join me in congratulating Dr. Desnick as the recipient of the 2022 Mount Sinai Lifetime Achievement Award for Healthcare Innovation.
Thank you, Eric. And I'm honored to receive the first MSIP Lifetime Achievement Award given at Mount Sinai. And I hope you can hear me. Can you hear me? And I dedicate this award to the many brilliant pre-docs, postdocs, and faculty who worked with me over the years. And we created an environment of entrepreneurism and really efforts to learn how to take care of patients and treat them effectively where there were no treatments for these diseases previously. So I can tell you today, it's very difficult to talk our young physicians into going into the lab. The day of the physician scientist is decreasing. It's been that way for as long as I can remember. But I just want to make one very important point, and it's sort of been my mantra, and I'll give that to you in a minute, but let me just tell you that everything that we did was focused on the prevention by screening and developing new tests and diagnostics, cloning the genes, doing molecular diagnosis, and treating these rare diseases. But the mantra is very simple, and that is that if you're a physician and you can see patients with your favorite disease that you're an expert at day in and day out, and for years. But if you develop a treatment, you treat them all worldwide. And that is the most satisfying experience that a physician can have. So I encourage all the young, particularly physicians, to get into the lab and do some research on your passionate disease, and you will come through with something that will have a great effect on the patients with those disorders. Thank you.
The next award is the Mount Sinai Pitch Challenge. And to introduce that is Cynthia Clayto, who's the Senior Director of Outreach, Entrepreneurship, and Special Programs. Cynthia, you want to come up?
On behalf of Mount Sinai Innovation Partners, I'm pleased to present the Mount Sinai Pitch Challenge Award to this year's winner, Tyree Williams. Tyree developed a novel mortar bone cement system designed to improve mechanical responses and post-operative care in patients who have undergone spinal surgeries. The Mount Sinai Pitch Challenge is an annual competition that serves as the culmination of MSIP's entrepreneurship program. The program helps evaluate, build, and refine healthcare solutions for Mount Sinai teams, and finalists who are accepted into the Pitch Challenge compete for a cash prize and pro bono services to continue advancing their solutions towards commercialization. MSIP looks forward to the next steps for the mortar bone cement system. Congratulations, Tyree, on this exciting achievement.
Good evening, everyone. My name is Tyree Williams. Once again, I am a joint PhD student, part of Rensselaer Polytech Institute, as well as a fellow in the Sinai Biodesign MedTech Incubator housed here. It's with my great pleasure to accept this award. It's been a great journey. I made a transition from neural and tissue engineering to more translational focused research, and it's been a great, rewarding experience. I see some of my fellow biodesign fellows in the back. The support through the MSIP team throughout this process has been great, and just making sure that we continue to have needs-based work, especially for thesis projects that are driven towards translational focused research. So with that, thank you so much, and I appreciate it.
Congratulations, Tyree, and a shout out to Cynthia, who's not only done an extraordinary job with the Pitch Challenge, but with a font of new ideas that you'll probably be hearing about in future ceremonies. So thank you, Cynthia. The next award is the Faculty Idea Prize. I'll describe this for you. It's an award that aims to support a collaborative, innovative research idea by junior faculty that can potentially be translated into a marketable product through the development of therapeutics, devices, diagnostics, digital health applications, and/or data-driven educational or community-based interventions. Presenting the award is Kai-Ann Goossens, who's an associate professor in the Department of Psychiatry in the Friedman Brain Institute and the Center for Effective Neuroscience. As she comes up, I also want to give a shout out to Lakshmi Devi, who previously served in the role as Dean Faculty Development and conceived of this award now about 4 years ago. Kai?
Hi, everyone. I'm here to represent the Office of Faculty Development for awarding this prize. As it was said, it's an award given to support junior faculty research that leads to a marketable product. This year, it was very competitive. We had 28 applications, and the winning application was selected because it proposed very clear experiments towards developing portable magnetic resonance imaging techniques to improve substance use disorder diagnostics. It's my honor to present this prize to this year's winners, who are Sairam Geethanath, who's an assistant professor in the Department of Diagnostic, Molecular, and Interventional Radiology, and also Shilpa Tawfiq, who is an assistant professor in the Department of Psychiatry. Congratulations to both of you. It's my understanding that the award will be accepted by Dr. Geethanath.
Good evening, everyone. My collaborator, Dr. Shilpa Tawfiq, and I would like to thank the review committee, the organizers, for recognizing this idea. We plan to introduce and utilize community neuroimaging to monitor therapy in substance use disorder patients from East Harlem here. These underserved patients usually have limited access to healthcare because of inequities in healthcare services. Neuroimaging and longitudinal neuroimaging, Dr. Arora mentioned some of this, especially in terms of the time aspect, is something that is challenging because 2/3 of the world does not have access to MRI, despite 7 Nobel Prizes and 40 years of MRI being around. What we plan to do is to develop and deliver autonomous MRI, which is portable, so that we can actually take the scanner to these patients. I'd also like to thank my postdoc, Dr. Pawan Pujar, and the rest of the family and in the lab and the members for this support. Thank you all for your attention.
The next award is the Killen Postdoctoral Entrepreneurship Award. Presenting this will be Gabriela Casaleno, who I think is virtual.
Yes, I am.
Hi. I'll just, a personal note, this was an award that really grew out of extraordinary loyalty of a group of talented postdocs to our programs. As they launched their careers, they at the same time looked back at the contributions Mount Sinai had made to their success and put forward this award, which recognizes postdoctoral entrepreneurs. Gabriela, do you want to read the description of the award? Hi.
Yes, I can do it.
Yes, please do.
Hi, everyone. I'm speaking today on behalf of all Kiln founders, a team of 5 former Mount Sinai postdocs, 2 of them now faculty members, who believe, apparently rightly so, that New York City was meant to become a hub for life science discovery and innovation. In line with our mission, Dr. Dan, McKnight, Varghese, Zorina, and myself established this award to praise innovation brought forward by postdoctoral scientists and to encourage the entrepreneurial spirit so important to close the gap between ideas and real-world impact. I am proud to say that our past winners and their companies are doing very well, and I'm very happy to announce that this year's Kiln Postdoctoral Entrepreneurship Award goes to Dr. Jun Ho-so, founder of Smart Maze. Congrats.
The original founders, or 2 of the founders of the award, are here represented.
Yep.
Well, 3.
Yeah. Congratulations. Very good. Okay.
Good evening. Thanks for coming and thanks for this award. I've always wanted to be an entrepreneur, a businessman. Come from a background of family background of businessman, and I'd like to thank Mount Sinai Innovation Partners and Keystone for incubating Innovation Life Sciences Network for supporting young entrepreneurs and scientists. Thank you.
Congratulations again. Let me just describe Dr. Sio's technology. Smart Mazes LLC was a project focused on designing and manufacturing economical, modular, and modifiable rodent behavioral apparatuses that can serve as multiple mazes for the purpose of basic and translational neuroscience. So congratulations again. The next presenter to present the I3 Prism Award is Cynthia Clayto again, Senior Director of Outreach, Entrepreneurship, and Special Programs. Cynthia.
On behalf of Mount Sinai Innovation Partners, I'm pleased to present the I3 Prism awardees for this year: Benjamin Rodriguez, Emily Lassen, and Madison Archer. Benjamin has created Metagraft, a synthetic bioactive graft that encourages ligament regrowth. Emily is working on antisense oligonucleotide therapy to address chronic kidney disease. And Madison has conceptualized a prostate cancer biomarker test kit that provides results quickly after testing. I3 Prism is MSIP's technology commercialization fund focusing on women and BIPOC healthcare innovators. The awardees receive funding to help advance their innovations, develop commercialization plans, and bring their inventions closer to the healthcare marketplace and the people that need them. MSIP is excited to see how these inventors will advance their technologies to their next major milestones. Congratulations to Benjamin, Emily, and Madison on this exciting achievement. We'll take pictures.
Congratulations again to the awardees. The next award is the I3 Genesis Award, to be described and presented by Louise Lammers, PhD, Director of Business Development, Mount Sinai Innovation Partners. Louise has been a fantastic partner in this and other activities around entrepreneurship, and so I'm delighted to have you present.
Thanks, Scott. Hello. I3 Genesis is a new program launched in 2021 by MSIP, and the intention is to fund and guide early stage technologies to achieve prototype or proof of concept data and to develop an IP strategy and ultimately result in an application that we can commercially partner or license out. So last year we did it for the first time, and we focused on digital health and devices. And there was such interest and enthusiasm, we actually expanded it this year. So I'm going to read out the names of the project proposals of the teams, and I'm going to read out all the project names because these, of course, are entire teams that work together on these particular activities. And I'm going to start with 2021. So the first award was a by design project called NINS, a non-invasive neuromodulation stimulator, and that was led by Dr. Ilaretta with Turner Baker, Alexis Bruhat, and Ben Rappaport. The second team is called Gambit, and that's a gamified approach to maximizing biobehavioral inhibition in trauma. And that was led by Jonathan Del Piero, Laurel Marlis, James Morrow, Dennis Charney, and Adriana Feder. The third award in 2021 was to Mark Rea, Bridget Bradley, and Andrew Behrman, and that was on bias-free pulse oximetry at low cost and high accuracy. The fourth award was led by Evren Azeloglu, and then was Eric Lima, Alan Benvenasti, Kirk Campbell, and Jacob Wright. And this was a device, a 3D printed device for dialysis. The last award in 2021 was an ocular one led by Gautam Kamtham and Sean Ianchulev, and that was for the surgical management of glaucoma. And if there are teams present this evening, if they could come down for a photograph now, please. Nice to meet you in person, yeah. So I'm going to have to I'm going to give them out one by one.
Right. Great.
There we are, for you. That's you.
Thank you.
All right, so and there we go. I don't think Gautam is here. I have two here, so maybe you can. Okay. Yeah. Okay. Right. In 2022, as I mentioned, we expanded it agnostic to whatever technology and applications. So we got a bunch of therapeutics as well. So we gave 6 awards. And the first award I'm going to mention is the development of a novel therapeutic strategy in colon angiocarcinoma. And that was led by Danielle Sear. And also in her team are Anna Torcheva, Elliot Merritt, and Emily Bramwell. The second one is another biodesign project called the Periscope Kit. This was led by Isabella Morgan, and also in the team is Josh Beddison, Mitch Baldwin, and Ben Rappaport again. And it was to do with evacuation of hematomas. The third project is called a deep learning approach to identify pathological features in biopsies for kidney transplant, and that was led by Weijia Zhang, and in the team is Stephen Ward, Fasika Tedler, Zhengzi Ji, and Kaxia Ji. Our fourth award is led by Yulia Lander and Rachel Jespersen, and this is entitled the Digital Health App, Resilience to Adversity Through Education and Dialogue for families of youth with psychosis and psychosis risk. And moving on to the next one. The next one is a digital platform for adjunctive adolescent cannabis use disorder led by Cara Bago, and then in the team, Angela Diaz and Ann Nucci. And last but not least is Dr. Brandwein with Mark Ergen on her team, and it's entitled A 3D Representation of Intraoperative Margin Mapping. So I'd like to invite anybody who's here to come down to receive a award and get on the photograph. Getting that? No, this must be this one. Congratulations. Congratulations. Thank you. Nice to see you again.
Wonderful to see you. Thank you.
Hello. Which one?
Isabella.
Is there we go.
Thank you.
Two. Cara. Congratulations. Congratulations.
Congratulations to all the Genesis Award winners. You can see some amazing ideas and talent. The next award is Diversity Innovation Hub Innovator Prize, and the presenter is Fariha Hassan, who is the director of the Diversity Innovation Hub for the Office of Diversity and Inclusion. We'll be hearing as well from Gary Butts with the next award. Please come up, and we'll look forward to your presentation.
Thank you. Hi, good evening. Thank you so much. My name is Freya Essen, and I'm so thrilled to be here today to be presenting the Innovator Prize. The Diversity Innovation Hub Innovator Prize aims to recognize an upcoming innovator entrepreneur who launched or created a meaningful innovation that addressed social determinants of health. As founder and CEO of Taika, Tanvir has been supporting the growth of local economies and accessibility of resources within our communities. His company curates smart city local data analysis to bodegas to help with consumer understanding, and by creating a marketplace allowing local communities to have more purchasing convenience. The impacts of COVID-19 were felt most by local economies, thus also impacting the access of resources. Through increasing customer loyalty, presence, and curating smart city local data analysis to bodegas, Taika is supporting and driving local communities. Congratulations, Tanvir. Of course. I think you're right there.
Okay.
Thank you for your congratulations, Tanvir. Really appreciate your partnership. Speaking of partnership, I'm delighted to introduce Gary Butts. I think Gary is virtual. Dr. Butts is the Executive Vice President for Diversity, Equity, and Inclusion and Chief Diversity and Inclusion Officer, the Mount Sinai Health System. He's made an extraordinary contribution to our community and to the innovation environment and ecosystem here. Dr. Butts?
Thank you, Scott, and thank you for the opportunity again to partner with the innovations ecosystem at Mount Sinai. And as a reminder, Sinai Innovation was an important partner as we launched the DIH a few years ago. On to the award. The Founders Award for the Hub gives recognition, appreciation, and acknowledgement to a key partner that has advanced the efforts of the Hub to create and increase capacity of minority and women entrepreneurs. As a co-founder and CEO of Rubicon MD, Gil Addo has been transforming the delivery of digital health through making specialty consults more accessible to all populations. In addition, Gil has been an advisor to DIH, guiding our strategic vision and continuing to support capacity building through offering our students opportunities for summer fellowships at Rubicon MD. Since the founding of DIH, Gil has offered hours in mentorship and strategic guidance to the DIH and our participants and partners, and has created a space for meaningful work for summer fellows from Mount Sinai to engage in research and collaboration with Rubicon MD. Gil, thank you for your substantial contributions to DIH and Mount Sinai. We look forward to so much more to come. Gil, congratulations.
Thank you. I'm virtual. I don't know if you guys are able to hear me okay.
Yeah, we can hear you.
I just wanted to take a moment here to thank everybody for the opportunity here and for the recognition. I'm honored and humbled by the recognition, and Dr. Butts, you've been somebody who's been a friend and mentor. So I appreciate you sharing such kind words. Rubicon MD's been, we've been built to support primary care access to specialty expertise, and our business and our vision has always been around this idea of democratizing access to medical expertise. And so we've done that, I realized just recently, for 10 years coming up this year. And it's been truly an incredible journey. If I could take a moment, just acknowledge a few people from that. First is, it certainly takes a tribe, but I want to thank and acknowledge my co-founder, Carlos. We've been on this incredible journey for a decade, and I think we're still just getting started. And he's been a partner as we've done this work across the country now. My wife, who's been an incredible supporter to shoulder a burden, including tonight, to allow me to continue to do the work that I do. And then in all things Rubicon MD. And then most importantly, I really do want to thank the Rubicon MD, our employees, but also our clinical partners, including over 8,000 primary care clinicians across the country who've trusted us to support the care that they deliver each day for patients. This used to be an expression during or prior to COVID, but those frontline workers, now we've seen they really are the heroes. And so we're just thrilled and honored to support them. And finally, I want to acknowledge and thank the Diversity Innovation Hub. It's critical kind of as we think about envisioning the health system of the future. And fostering innovation, that we think differently if we do want to build a more equitable health system going forward. And the Diversity Innovation Hub is at the center of that, and their work is so important. So I'm honored to be a part and play some small role. there. So thank you all for the honor. I appreciate the few moments here.
Thank you both very, very much. Appreciate it. And congratulations again, Gil. Keep up the great work. The next award is the Thrive Fellowship. It will be presented virtually by Dr. Kevin Costa, who's an associate. Oh, he's here. He's live. Just a shout out to Kevin. He's been an extraordinary font of ideas and energy. He showed, along with Janice Gabrilov, tremendous resilience in trying to keep the spirit of our hackathon alive through the evolution into the Thrive Fellowship, which has been a huge success. So I want to thank you for that, Kevin, and please step forward. Thank you.
Thank you, Scott. It's my pleasure to be here to introduce the Thrive Fellowship Awards. So Thrive is Mount Sinai's Targeted Healthcare Innovation Fellowship. It's a 9-month program where participants from diverse professional backgrounds develop innovations in medical devices and healthcare technologies. Thrive was created and is run by a collaboration between Sinai Biodesign, which in particular I'd like to shout out to Joe Borello, who's really been the face and the heart of Thrive, Mount Sinai Innovation Partners as well, and Conduits, the Institute for Translational Sciences at Icahn School of Medicine. The Thrive Fellows experience a unique opportunity to work in the medtech innovation space, supported by top researchers and clinicians from Mount Sinai's community, where they also develop experiential team science skills by collaborating with other talented and motivated trainees. The program challenges the teams to take an idea from concept to commercially viable innovation and provides application support to major innovation programs inside and outside of Mount Sinai, such as the New York City Regional I-Core Node, eLab New York City Media Lab, Mid-Atlantic BioAngels, and the Mount Sinai Pitch Challenge. So we're honoring four Thrive teams today. The full teams and their faculty advisors are mentioned in the pamphlet, in the program. First, I'd like to mention Spinovations, which is comprised of Tyree Williams, Ian Odland, Eugene Rabachuk, Zara Irshad, and Janvi Patel. Ian will be accepting the award for Spinovations. This is a multidisciplinary team working on developing a new spinal screwdriver for more patient-centered, minimally invasive surgeries. They participated in the MSIP Tech Launchpad, the NICERN Regional I-Core Program, and New York Business Plan Competition, and they were awarded funding in all 3 of these programs. So are we doing one at a time to come down? Or how do you want? Or I can just run through the 4. Okay. So Ian, if you can come down, I guess, and just take a moment. Then CPPAI, which is the one-man team of Faris Goulamali. And he's focusing on the problem of non-invasively monitoring intracranial pressure, a crucial metric for neurocritical care, but one which is currently only measured through invasive procedures. And they've participated in the MSIP Tech Launchpad and Pitch Challenge and the New York Business Plan Competition and submitted a proposal to the I3 Genesis program. So Faris, if you could come down also. The third team is Metaphor, comprised of Hyomin Siu and Brian Sung, sorry. And Brian's going to be accepting the award today. This is developing an AI-based system to detect early signs of Alzheimer's disease and the speech patterns of non-English speakers. There's been extensive research and development around speech pattern analysis of English for a number of neurological conditions. However, in other languages, this has sort of been an underserved area. So Brian, if you could come down. And then the final team is SSI Detection. This is Jenny Chen, Nasif Kasim, Sushuta Iruvanti, Vivian Uti, and Vivek Prakash. And Vivian is going to be accepting the award today. This team has been working on a system to detect early signs of surgical site infection following vascular surgery procedures using a combination of clinical biomarkers and remote visualization and monitoring technologies. They've largely worked on data gathering and building the framework for the AI-based model, and they plan to use this to make assessments of patient conditions. So if Vivian could come down, and just a round of applause for all 4 teams. This is for Vivian. Brian.
Next are the Trainee Innovation Awards, or Trainee Innovation Idea Awards, I should say. This was really modeled after the Faculty Idea Award, which we thought was so successful, we extended it to our trainees. And just to make a fine point, obviously, to create a culture and an ecosystem of innovation, we need to incorporate not just the more senior or established scientists, but the trainees, and to motivate them to come up with new ideas and think big. And so the winners of these awards really represent that idea. To introduce the two trainee innovation, the MD and MD PhD Innovation Awards, we should have online Praveen Raju, Associate Professor of Neurology and Pediatrics, Co-Director of Children's Brain and Spinal Tumor Center, and Dr. Urena Clark, who's an Associate Professor of Neurology and Associate Director of the MD PhD program. Are you both there?
We are. Can you see and hear us?
Well, let's let the AV folks get you on the wide screen. Just a second. There you go. If we could just remove the white box, please. Great. It's all yours. You look great.
Thank you. Well, good evening, everybody. We are very honored and proud to present the winners in the MD and MD PhD category. And here the award goes to Alex Serafini, who is accepting on behalf of the team, which also includes Justin Frere, Dr. Vana Zakariou, and Dr. Ben Tenover.
Their group established a hamster model of long COVID-19 and provided a detailed transcriptomic analysis of several organs that recapitulated findings in long COVID-19 patients. And this work enabled the team to identify potential therapeutics for several symptoms of long COVID-19, including new onset pain. So congratulations to Alex and his colleagues on this very impactful work.
Congratulations.
With your permission, I'll do the real-time handover on your behalf. Great. And Matthew, are you here? Matthew O'Connell? Oh, there. Oh,
Yeah,
he's
I'm here.
virtual as well. Okay. Very good. So the PhD award will be presented by Matthew O'Connell, Senior Associate Dean for Curriculum, Recruitment, and Admissions in the Graduate School. Matthew?
So thanks, Scott. You know, every year when I get to read these submissions, it's amazing that our brightest and also youngest scientists on campus come up with these tremendous ideas. And this year was no exception, with several really interesting projects. But the winner this year, who I'm proud to say is one of our students who's been outstanding academically, outstanding in research, and also an incredible ambassador for the school. And this is Pushkala Jararam. Pushkala developed Visio, I hope I'm saying that correctly, Visualization for Information in Electronic Records, a machine learning approach to mining patient data, showing her incredible skills as a computational scientist. So my full congratulations go to you, Pushkala. Congratulations.
Matthew, with your permission, I'll do the handoff.
Please.
I couldn't agree with you more, Matthew, and thank you. So the next presenter, Adriana, are you here? Great, wonderful. Dr. Adrienne Malone, who's the Senior Associate Dean for Graduate Medical Education, Associate Professor of Medicine, will present the Postdoctoral Fellow and House Staff Awards.
Good evening, everybody. It gives me no greater pleasure than to highlight the innovation and achievements of our trainees. On behalf of the Office of Graduate Medical Education and Dr. Michael Lightman, I am honored to present the Trainee Innovation Award for Postdoctoral Fellows to Dr. Won-Tak Han and his team for the project of identification of gut microbiome metagenomics features for the development of a clinical prediction tool for inflammatory bowel disease. Congratulations. I am now delighted to present the Trainee Innovation Idea Award for House Staff to Dr. Harry Anastos on his project studying the expression of immune checkpoint proteins in the peripheral blood of patients with elevated prostate-specific antigen to predict the presence of prostate cancer. Congratulations. I don't know, is Dr. Anastos here? I guess not. Well, congratulations. I thought the project was fabulous. So, all right. Thank you.
So with that, we will close. Just a couple of quick announcements. A reminder to the winners to please just cluster outside the door here for a group photo. Again, I want to thank the Dean's Office and my team for doing a spectacular job in putting this together so seamlessly with the virtual and real presenters and organizing everything. If you have a team member who's not here, if you would think of it, we have lots of extra plaques for those who either weren't here or accepted virtually, and if you could come get them. Otherwise, please notify Melody Tam, who can find a way to get these to you directly. So with that, I want to thank all the presenters and all the awardees and those who also applied for many of these awards. I think the state of our innovation ecosystem could not be brighter. I think we've weathered a challenging couple of years, and in some ways it brought out even more talent and more resilience. And so I'm really proud to have represented part of that. And I want to thank you all and congratulate you. Good night.